my best nurse ever. In this video, we'll discuss career guidance for nurses, focusing on education, certifications, career paths, and key skills. To boost your nursing career, earning a Bachelor of Science in Nursing, or a BSN, is highly beneficial. A BSN opens up more job opportunities and offers greater potential for career growth compared to an associate degree in nursing, or an ADN. For advanced roles and leadership positions, consider pursuing a Master of Science in Nursing, that MSN, or a Doctorate of Nursing Practice, that DNP. Certifications like Advanced Cardiovascular Life Support, ACLS, Pediatric Advanced Life Support, PALS, and the Neonatal Resuscitation Program, NRP, can enhance your skills, particularly if you're interested in specialized fields. To succeed in nursing school, it's important to stay organized by tracking assignments and clinical hours. Study regularly rather than cramming, join study groups for diverse perspectives, and seek help from instructors or classmates when needed. Balancing your studies with self-care is crucial to avoid burnout. Nursing offers various career paths, including bedside nursing, advanced practice roles such as a nurse practitioner, nurse anesthetist, and clinical nurse specialists, as well as opportunities in administration, education, research, and specializations like critical care, emergency medicine, pediatrics, and oncology. Here's a quick overview of some nursing specialties. Emergency nursing, which is fast-paced care for acute illnesses and trauma. Critical care, which is caring for critically ill patients in the ICU. Pediatrics, which is nursing care for children from infancy through adolescence. Oncology, which is care for cancer patients. Surgical nursing, which is assisting in surgeries and providing post-operative care. Geriatrics, care for elderly patients. Psychiatric nursing, focusing on mental health care. New nursing graduates should anticipate a steep learning curve, long hours, and the need to quickly adapt. Stay open to learning, ask questions, and seek support from experienced colleagues. A typical day for a nurse includes assessing and monitoring patients, administering medications, collaborating with healthcare professionals, updating patient records, and educating patients and their families. In the emergency department, your work can range from treating minor injuries to handling life-threatening conditions. The most rewarding part of nursing is making a positive impact on patients' lives. However, the most challenging aspect is managing high-stress situations and the emotional toll of patient outcomes. Key skills for a nurse include compassion, resilience, attention to detail, critical thinking, and effective communication. In high-stress situations, it's important to stay calm, focus on tasks, seek support from colleagues, and participate in debriefing sessions. If you're considering becoming a nurse, it's essential to understand the demands of the profession. Nursing is a lifelong learning journey. To prepare for nursing school and your career, focus on building a strong foundation in sciences, develop time management skills, gain practical experience as a certified nursing assistant, that's CNA, or volunteer in healthcare settings, and network with current nursing students and professionals for insights and advice. Networking is crucial for career development, job opportunities, and support. Find mentors by connecting with experienced colleagues, joining professional organizations, attending conferences, and using platforms like LinkedIn. Lastly, technology has significantly improved patient care through electronic health records, those EHRs, telemedicine, wearable health devices, and advanced medical equipment. Staying updated with tech skills will enhance your practice. See you soon, my best nurse ever.